Coma. Coma, derived from the Greek word coma, which means deep sleep, is a medical condition characterized by a prolonged state of unconsciousness. However, the patients may have a decreased level of consciousness, and their eyes may be closed. They may also have a reduced response to pain and other stimuli. It is a condition that various factors, including traumatic brain injury, stroke, drug overdose, metabolic disorders, and infections, can cause. A coma is diagnosed based on the person's symptoms and medical history. A physical examination is performed to assess the person's level of consciousness and to look for signs of injury or illness. Imaging tests, such as a CT scan or MRI, are performed to look for abnormalities in the brain. Several medical scores are used to assess the severity of a coma, including the Glasgow Coma Scale, GCS, the most commonly used scoring system for assessing the level of consciousness in a person with a coma. It evaluates 3 parameters: eye opening, verbal response, and motor response. The score ranges from 3 to 15, with a lower score indicating a more severe coma. Full outline of unresponsiveness 4 score is a newer scoring system that evaluates 4 parameters: eye response, motor response, brainstem reflexes, and respiratory pattern. The score ranges from 0 to 16, with a lower score indicating a more severe coma. Coma Recovery Scale Revised, CRSR, is a comprehensive assessment tool that evaluates multiple domains of recovery in a person with a coma, including auditory, visual, motor, and communication functions. The score ranges from 0 to 23, with a higher score indicating a better chance of recovery. The Rancho Los Amigos scale is used to assess the level of cognitive functioning in a person with a brain injury, including those in a coma. The scale ranges from level 1, no response, to level 8, purposeful and appropriate response. The scores are just tools to help assess the severity of the coma and guide treatment decisions. However, the outcome depends on many factors, including the underlying cause and the individual's overall health. Treatment for coma depends on the underlying cause of the condition. Sometimes, the person may need to be placed on a ventilator to help them breathe. Medications may also be given to control seizures or reduce brain swelling. In some cases, surgery may be necessary to remove a brain tumor or to relieve pressure on the brain. The prognosis for coma varies depending on the condition's cause and the injury's severity or illness. Sometimes, a person may recover from the coma with no lasting effects. However, in other cases, the person may have permanent brain damage or never regain consciousness. Several complications can result from coma. These include infections, blood clots, pressure sores, or develop muscle weakness, or contractures due to immobility for an extended period.